So our small town's history is incredible related to healthcare. It started over 100 years ago in 1918 with the flu epidemic. An Episcopalian lodge was converted into our first temporary hospital. In the 1940s, the community came together to raise funds for a larger hospital. The Uinta County Hospital was built in 1948, which doubled the number of hospital beds and patients that could be seen. It's amazing to think that the community was self-supporting. It really means something to care for our community, especially our friends and neighbors and family. Even though we're a small town, we have a state-of-the-art facility along with specialists to provide exceptional care for our community.
When I moved my dad here in fall of 2023, shortly after he got here, we received a cancer diagnosis for him. And immediately I was concerned about what the treatment would look like, knowing that we were in this kind of isolated area. And I was just afraid of having to drive to the city frequently, make 3-hour trips, and stay for extended periods of time.
So previously, cancer care, patients who needed chemotherapy or any type of treatment, even to visit with their oncologist, they had to drive 3 hours to get to the closest center. We saw this large need in our small community. So at Uinta Basin Medical Center, we've decided to take one of our older buildings and remodel that and create our new cancer care and infusion center where you can be visiting with the oncologist and also receiving your chemotherapy on the same day.
I am so excited for the new cancer care facility in Vernal to be completed.
So in the new cancer care and infusion center, they can get their labs quickly, they can get their results quickly, and they can get their treatments without the travel and the expense. This allows our small town community and patients to receive the big city treatment.
We are so blessed that we don't have to travel out to Salt Lake City every time he needs to meet with his oncologist. His care team here has been phenomenal. They're not only caring for him, but they're his friends. It makes his diagnosis a little lighter to carry, and that means the world to me and to him.
Rural communities in Utah have a nursing shortage. We like to say we grow our own here. They graduate from here and then they stay here to work to fill up those gaps with the shortage.
After I got into USU Uinta Basin's program, one of the reasons why I appreciate being trained as a nurse here in the basin, here in my own community, is because it allows me to see what's really happening in our community, see the struggles that we face daily. I wanted to help people in a time of need, in a time of suffering, and help be a little part of that.
Our local healthcare facilities support our students by allowing them to come in to their facilities and do their clinical hours. They really are invaluable to their education. In the ever-increasing days of hybrid and online programs, I think face-to-face and that hands-on learning skills is so important to make them successful, competent nurses.
At Uinta Basin Healthcare, we find it very important to have a pulse on the highest concerns in our community when it comes to health. In our latest community health needs assessment, mental health rose to the #1 spot by a landslide. And our suicide rates here in our Tri-County area are triple that of the national average. Those numbers are alarming, they're scary, and they're definitely a call to action. In our small community, each person matters, and when one of us is hurting, we all feel it.
Suicide has affected my life from a young age, and nobody would talk about it, right? It was taboo. And what I learned with losing my son in 2012 was that we can have a conversation.
We know in our community and in our small town that many families have been affected by suicide, and this is something that we never want anybody to have to go through.
We just don't have enough trained professionals to help with mental health. Utah State University developed the Masters of Social Work program to train individuals to be mental health professionals and offers that to the rural campuses.
The graduates that graduate in the MSW program here in the Uinta Basin are ready to hit the ground running. They've had great practicum experiences and know how to diagnose and treat clientele that they're going to work with.
It really can be overwhelming to even know where to start, who to call when you're struggling with some mental health difficulties. There were several community partners that came together to really try to tackle this problem.
We built the platform Mental Connection to provide that centralized platform to make access to care as easy and comfortable as possible.
So if I'm an individual that's looking for specific counseling, maybe for my depression, I can go on this website and be able to find who in my area takes my insurance and has availability to see me.
A large barrier to accessing mental health services can also be cost. As the public provider, we want to make sure that financial barriers do not stop people from getting help. That's why one of the things we do is we provide 24/7 crisis services free of charge.
In our area, we are seeing the conversations open up a little bit more in schools, in faith groups, community groups, social media. That shift is very encouraging for us. And our goal with Mental Connection is to keep that going and to open it up even more and to normalize talking about mental health in everyday conversation.
As a mental health professional, isolation is a huge concern. And so anything that we can do to combat isolation is going to be very productive for our mental health and for our physical health. So one thing that we really want to tell the community is to get out and to get connected, help your neighbor, spend time with people. It's really critical for our mental health.
My name is Sandy. I'm 78 and I've lived in Vernal my whole life. I have a dog named Shaggy, and right now he's probably my best friend. I live on a farm. I was married a long time and my husband passed away, and it's really hard because if you live alone, sometimes it's easy just to isolate, and I found that I have to really work at getting out. I like to go to the rec center because it's a community and I'm comfortable at the rec center. It feels like a safe place, and the people who work there are amazing. I always get help when I need it. I've had exercise equipment at home, but I got rid of it because I thought I need to get out, I need to go somewhere. I think it's very important to stay social, and it's hard, but I like to go, and I do see the same people. It's a community. For me, the most important thing is to keep moving.
When we live in these small rural communities with limited resources, we can't afford to work in silos. We have to collaborate and connect because alone we can make a ripple effect, but together we can create a wave of change.
I see a future that's bright. I see a future that is full of partnerships, that has investment in the gaps in healthcare to make sure we make communities healthier.